I'm Dr. Sai Vigneshwar, consultant physician and diabetologist in Unitas multi-specialty hospitals. Diabetes. Diabetes is becoming a global burden, and we have an estimation of 70 million population living with diabetes at the end of 2030. In spite of all the advances and all the medications, why is it becoming a global burden and why is it becoming a big headache? The first thing and the very important thing that is always left untouched in terms of diabetes is the food and what sort of food should be consumed and what should not be. So always make sure that you follow 3-thumb rule when you plan a diabetic diet or when you start planning a diet for diabetes. The first thing is always make sure that you have small meals every 2 hours once. And the second one is never ever skip your breakfast. And the third thing is always make sure that the food that you consume is going to be less in glycemic index. Always start your morning routine with a tomato juice or a warm water with chia seeds or warm water with cinnamon. And also, if it is not possible, always go for the green tea, which all these things will have an increase in the amount of oxidative stress relieving things, which will indirectly reduce the pancreas inflammation and thereby increase the insulin levels. This should always be followed up with the vegetables and fruits and the grains that you are going to plan for the day. So starting with the foods, we'll begin with the green leafy vegetables. So the two important green leafy vegetables is going to be your spinach and the drumstick leaves. So why there is an increased importance on the spinach and the drumstick leaves? These two things have very less calories and very less carbohydrates and comparatively increased amount of fibers. So this combination is going to increase the amount of insulin and thereby decrease the glucose absorption. So this will always have a very direct impact on your blood glucose levels. The second thing that we are going to look upon is your grains and the beans. Always make sure that you substitute the refined grains with the whole grains. The whole grains in a sense, which is going to be the red rice as well as the other things that you are going to consume with the red rice. The ragi is going to play a very vital role because ragi has a decreased glycemic index and ragi naturally increases the amount of insulin in your body, thereby decreases your blood sugar levels. The third thing is going to be your beans. The beans, which is of prime focus here, are going to be your soya bean and your kidney beans. Why the beans have to be consumed and at what time the beans has to be consumed? That why is going to be the beans are complex carbohydrates. Though the carbohydrates goes against the blood sugar levels and diabetes, complex carbohydrates are very good for diabetes because complex carbohydrates take a pretty long time to digest. Thereby, it will decrease your appetite and the amount of cravings and amount of need for you to consume food is going to decrease. Thereby, the blood sugar levels will decrease indirectly. The next thing which you are going to see is the fruits. So, two fruits are very important. One is going to be your berries and the next one is going to be the citrus fruits. Coming to the berries, the prime berries that we are supposed to consume are going to be strawberry and the raspberry. So why should a strawberry has to be consumed for a diabetic? Though strawberry is a very good fruit, it also has an increased amount of vitamin C and bioflavonoids, which is going to increase the blood insulin levels and decrease the sugar levels. And next is going to be a citrus fruit. As we all know, citrus is rich in vitamin C, and the vitamin C will always decrease your blood glucose levels and it will definitely increase your insulin levels. And a very prime function and importance of vitamin C is it will decrease the oxidative stress, thereby the amount of inflammation on pancreas is going to be decreased and thereby the insulin production is going to increase. Coming to the foods that we are supposed to avoid in diabetes, the first thing is going to be your white bread, white rice and white potato followed by pumpkin. And please make sure that you avoid consuming packaged foods and especially all the sugary drinks. If there is going to be an increase in the amount of intake of white breads or white rice, definitely it is going to pose a very big threat for the sugar levels to be in control. Always make sure that the stress levels is under control and always make sure to have 30 minutes of walking every single day, or 30 to 45 minutes of working out or jogging every single day, depending upon your work routine. And last but not the least, always make sure to consult your diabetologist very frequently, as well as put your medications on top priority along with the food habits, so that we can reduce the global burden that the diabetes is causing. Thank you.